Hello, Dr. Johnny Hyde with Commonwealth G1 Oncology with Bon Square Medical Group.
We're here today to talk about ovarian cancer since it's Ovarian Cancer Awareness Month. So, who is at risk for ovarian cancer?
Well, there are about 22,000 women every year in the United States that come down with ovarian cancer or diagnosed with ovarian cancer. The risk is about 1 in 70, 75 women. The average age is about 63. There are certain women that are at higher risk, women who carry genetic predispositions such as BRCA1 or BRCA2 mutations, but there are also some other mutations that carry a smaller but still substantial risk.
What are the symptoms of ovarian cancer?
The symptoms, unfortunately, with ovarian cancer are predominantly brought on by the spread of the disease. Bloating, abdominal pain, early satiety, which means you feel full quickly after eating, changes in bowel bladder habits, diarrhea, constipation, a lot of vague symptoms which people often will overlook or explain away.
Are there any screenings that are available for ovarian cancer?
Unfortunately, no. There are screening for patients who are at higher risk, patients who have a known genetic predisposition. We may monitor those patients a little more closely, but for the general population, there is not a really good screening test. CA-125 can sometimes be helpful in evaluating someone that has a known mass, or sometimes in use with patients who have a known family history, but as far as screening the general population with ultrasounds or CA-125, it's not recommended.
If I have been diagnosed with having a BRCA mutation, do I need to take any preemptive steps for treatment?
It depends upon the age. We do, for patients with BRCA1 or BRCA2 mutations, we do typically recommend, or at least the guidelines recommend, risk-reducing surgery, meaning oophorectomy, at the age of 35 or once childbearing is complete. The reason that age is selected is it's very odd, even for a BRCA mutation, to develop into an ovarian cancer prior to the age of 35. There's also so prior to that, we may do some enhanced screening, ultrasounds, CA-125s for higher risk individuals. But also for women with BRCA mutations, they need to speak with their breast surgeon about the possibility of prophylactic surgery to reduce the risk of breast cancer as well.
How is ovarian cancer treated?
It's typically a combination of surgery and chemotherapy. It's typically a 1-2 punch. Most instances, we take the patients to the operating room and remove as much of the disease as we can. The unfortunate thing with ovarian cancer and the nature of the way it spreads, it's very difficult to quote unquote get it all. But there is clear evidence that if you're able to remove the bulk of the disease, patients will respond better to the next step, which would be chemotherapy. Chemotherapy typically is 5 to 6 months of treatments every 3 to 4 weeks. And the good news is most of the time, after the combination of surgery and chemotherapy, most patients will be able to achieve a clinical remission, meaning no evidence of disease.
Are there any new treatments or drugs that are available for ovarian cancer?
Yes, there are. We were on a dry spell there for a while, but recently there have been a few new additions to our armamentarium for treating ovarian cancer. Probably the most exciting would be the PARP inhibitors, which are an oral therapy. They're first approved for patients who had a known BRCA1 or BRCA2 mutation, but now they've been expanded into maintenance therapy for all comers, even those without BRCA mutations. And it appears that they work just as well in those patients as well. It's nice that it's an oral therapy, so it doesn't tie them to the infusion center, and it allows them to sort of resume some normal activities of life.
If I think I have some symptoms of ovarian cancer, do I go to my regular gynecologist, or who do I see for treatment?
It's probably a good idea, yes, to either go to your primary care physician or your primary OBGYN. I think most of them now at least have an eye out for the signs and symptoms of ovarian cancer and are quick to refer when they are concerned, or at least quick to send someone for additional imaging, which would be the ultimate in diagnosing ovarian cancer.
What type of imaging would be used?
Depends on the presentation, the exact symptoms. Most of the time, either a pelvic or abdominal ultrasound or a CT scan of the abdomen and pelvis.
Thank you. Do you have anything else to add?
Simply listen to your body. If you have any of these vague symptoms, abdominal pain, bloating, feeling full after you eat, changes in bowel bladder habits that persist, that's the key. Whether if they persist for an extended period of time, that needs to be evaluated because that could be the early signs.